Good morning, everyone. Lydia-Joi and I are here today from Health Commons Solutions Lab. We're a social innovations lab based out of Mount Sinai Hospital, and we work to increase vaccine confidence, testing uptake, and just in general to provide wraparound supports for communities that are most impacted by COVID-19. So we're here today to help you promote the vaccine and just talk to your community about it and to just inform them and help them make an informed decision.
As Nour said, I'm Lydia-Joi, one of her colleagues, and we've been doing this since the beginning of the pandemic. I guess it's almost 2 years now. And so we have a lot of insights from some ambassadors that are across the province that we just wanted to share with you of how to support your community so that you feel confident when you're going out.
Hi, everyone. My name is Mohammed Nassimi. I'm working as a settlement counselor at UCISO, and I'm volunteering with Ottawa Public Health, helping them in translation in Persian and Pashto.
Thank you so much. Thank you all for joining us today.
So let's start off with the land acknowledgement.
So we just want to, because our focus is always on equity, both Nour and I are actually in Mississauga. We're not in your area today, but we wanted to acknowledge where we're coming from. And we know this might look a little bit different where you are. So we acknowledge that this land that we meet on, were for thousands of years, the traditional land of the Huron-Wendat Petun First Nations, and most recently the Mississaugas of the Credit River. So today our virtual meeting is still home to many Indigenous people across Turtle Island. And we have the opportunity to work in this community and on this land. So we are both settlers. We're actually both immigrants on this land. And we recognize the broken treaties, attempted genocide, and injustice against the Indigenous people on here, what is now called Canada, that have spanned for centuries, and the oppressions that are still prevalent today. And so this statement, we say not just as something that's traditional, because it's meaningless unless we are committed to be on a personal journey of truth and reconciliation, which we are and we do commit to.
So today's agenda is going to cover welcome and introductions. What is a vaccine ambassador? So what your role is going to be, understanding different worldviews. And then we're going to just have a quick refresher on what COVID-19 is. And then we'll discuss root causes of vaccine hesitancy, and then how to find credible sources. And then we'll end off with current hot topics. We will be sharing this slide deck for you. So it's a take-home resource that you can use at any time, because we know some of these topics are very granular, very detailed, and it may be overwhelming for you today. So it's taking it at your own pace. So for whenever you want to know more details and you come across different things in the community and you have more questions, you can always go through this document and find whatever resource you'd like.
So as we said, we've kind of been doing this over the last year, and this role in itself, like people call it different roles. We say community ambassadors, community outreach, vaccine specialists, but really we just want for you to know that what we're here to do is really just support the communities that we are a part of. So we're really just here to allow people that we are already together with to feel safe, to have proper information. So, you know, some examples of this here are, like, you know, if you test positive, you and your household will be taken care of. So we're here to let people know that it's not only about the vaccine, it's not only about COVID-19, it's knowing that as a whole person, we care about you and your household, and we have supports to help you. Our role is to make sure that we're outreaching people and making sure they're being able to be tested. So in addition to vaccine, you know, that's one of the tools that we have here, but that they stay connected and that we're testing and knowing, you know, what the spread is. So we're really here to share this information with our community and be the center of that they know that this is a trusted place for information about isolating, about COVID-19 itself, about vaccinations, about any type of wraparound supports about our health, and bringing this information back to where it is we either work for or we work with, that we can kind of know, you know, what the conversations are like in the community.
Okay, so we're on to the next section, which is understanding worldviews. This is going to help guide you with every single conversation that you're in. Before you delve deep into, different, very detailed questions about the vaccine or about COVID itself, you'd have to understand like the bigger picture, which is the trauma-informed approach. So trauma-informed approach or care, depending on what you want to call it, is a very big topic. It could take 2 hours to get into it. And we actually even have a slide deck here for you that you can delve deeper into. But just, as a little, just to give you a taste of what it's about, it's this idea that within our minds, within the way that we behave with the entire world, is that anytime we are scared, anytime we are worried about something, or like we are threatened by something, there is this part in our brain, this very, very early part, and it's like one of the first things that ever develops. And even the smallest creatures on this planet have the same exact thing. It's, there's this structure in the brain called the amygdala, and it makes us, every time we see a threat or something that scares us, it makes us defend ourselves. And that way we protect ourselves. So for example, whenever we experience trauma, and here trauma can mean anything. It doesn't mean a car accident or a death. It can mean something as small as, when you're a child and then you fall off a bike and you get really hurt. Your body and your brain wants to protect itself from getting hurt again. So what your body does is either fight or flight or freeze. And what that means is fight, you either get defensive, you get angry, you push back, you hurt. You flight, so you run away, you avoid, or you freeze. You just you freeze in place and you don't know how to respond. You can't respond. And so then you might be thinking like, I came here to talk about vaccines. What does this have to do with vaccines? So the thing is that a lot of people, when they think about vaccines, when they think about COVID, they get scared, and it hits that very, very primitive part of our brain, that part of our brain that only sees a threat, and it says fight, flight, or freeze for a lot of people. So we have to kind of understand how that works and why it works. And so when you enter a conversation with someone who you feel is coming off as very aggressive or very angry or very scared of the COVID or the vaccine, understand that this is something that's very deeply ingrained in us, that whenever we are scared of something, we have this type of response. And for people who have had negative experiences with the healthcare system or with governments, they are primed to defend themselves from being hurt again. Okay, and we're going to go deeper into that, but just for now, understanding that there are many marginalized groups that have been experimented on in the past and in the present, who have had very terrible experiences with the government, and that has led to them being hurt, and now they no longer trust these larger forces. And so whenever they see things like COVID and vaccine, they are scared of becoming hurt again. And so they are responding in such a way to protect themselves. So whenever you're dealing with marginalized communities, especially, think of the trauma response as the response that they are doing because they are protecting themselves from further harm, because they have already experienced something, even if it's like within their lifetime, or something generational where, for example, their grandmother that was experimented on or was mistreated by healthcare professionals, or all throughout the generations that, that family has always, because of their race, been discriminated against, or anything of that nature. They will now try to protect themselves against further harm. And that's what you're seeing. Although at the surface, all you're seeing is someone who is hesitant, there is something beneath that. So it's somewhat of a complex problem, complex concept, but when you see it over and over again, you will learn to recognize it. And then the second concept we kind of want to drive home as well is this idea that who you are and what your opinions are and how you see the world is all shaped by your position in the world. So what race you have, what gender you have, what's your social economic status, which means like how much money, what type of job you have, where you live in the world, your ability. So if you have a disability or not, how old you are, your citizenship status, your sexuality, and your religion. All of those things shape what you believe and how you see the world. And so that means that whoever you're talking to will also be shaped by their own identities, by these same exact things. And so they will come to see the world in different ways. So whenever you want to talk to other people, understand that they have different perspectives because of the different reality that they live in. And so they have different perspectives. And so how do you support people with different perspectives, right? That's what we want to get at today. So people have different traumas because of they are more likely to have certain traumas because of certain identities they have. So for example, if you are a woman, if you are Black, if you are a person of color, if you are disabled, if you are poor, if you are old, if you are young, you are more likely to have certain type of traumas than others. So just, I guess, going back to positionality is that, trying to understand people's different perspectives in the world and why they see things the way they do can be shaped by parts of their identity, and just trying to be empathetic. Look for the things that make you think the way that you think and make others think the way that they think. And how is their identity shaped what they think? How is their position in their world given them a different lens or a different point of view to the same object that we're all looking? So if there's one object here, you can, be seeing it from this lens, from this direction. Someone else can be seeing it from this direction. And so that you both may be seeing very different things, even though you're looking at the same exact object. So trying to understand people's positionality in the world, why they've come to see something the way that they've come to see it, and understanding the trauma that they may have been through really helps us empathize. Rather than judge people for thinking the way that they think, just because you think it might be wrong or right. Lydia-Joi?
So the reason we're spending so much time on this part of the conversation is because, there's kind of an impression, because we're doing, vaccine confidence, because we're having this conversation, that, we all feel and we know the science behind it and why we're doing it to benefit people, but we really want to make sure that we understand why people have these very views. And so there's some things just out of our experience, having been out in the field over the past year, of things that we'll encourage you to do and not do as you're going out and speaking to people. So first of all, as much as we are trying to support people, we are having these conversations, we still care about you first. So, as an ambassador, you still have to maintain your own safety, whether that's physically, whether that's ensuring to, make sure you're following the guidelines of social distancing, of how you speak, of the PPE you're wearing, whether that's masks, how you're touching, what you're washing your hands. Make sure that you're looking out for yourself first, and that includes your mental health too. If you're in a situation that feels abusive or you're being attacked, you can't just, push through and say this is your job and so it's okay. We want to make sure that you are safe so that you can serve others. You also, make sure that you connect with the people that you're speaking with. This is not just a job. We've heard so many times of people saying, how are we doing this and we're committing to this together? We are part of the community. We are doing this work because we want to support others who are with us and connect with people on that level. It doesn't have to be a removal of yourself when you're having those conversations. That being said, though, we have to be respectful of people who have different beliefs or cultural norms. So we really don't want to speak things in terms of, well, you know, everybody sees this way, or this is what you should do. Really, we're here to be listeners, and to try and understand who we're speaking with and where they're coming from. So when we're doing this, what we really just want to do is to provide neutral facts. So if we're giving, someone wants to find, you know, information about the vaccine, about COVID, about resources, and we'll give you some examples of it a little bit later, it's to provide facts in a neutral way, and as opposed to trying to push people in one place or another. You'll encounter a lot of people who have problems that might be outside of what you thought the conversation you were going to have. And so we have to really be adapting and be able to address this, problem solve whatever they need that might clear the barriers to address whether they want to get a vaccine or something else. There might be other things that you have to be able to take care of before you even get to that conversation. And so, you know, what you are really here for, in addition to listening, is to share these learnings both ways. Like, maybe you're going to be hearing questions over and over that are in the same thing when you go into community. Bring that back to your employer, to us, to the community, so that we know, are we really addressing the needs of those who we're serving? And so our don't list is kind of just in relation to that. It's just on a whole, don't be afraid to ask for help. You don't have to know everything. We're not going there and just saying you're the absolute expert in that moment. You can bring back questions. Your part of your job often will just be to collect what people want to know and come back and provide resources for them to address it later. So in this way, you don't have to worry about making mistakes. As long as you're respectful, as long as you're saying, hey, how can I help you? How can I go further? It's really about, you know, you're learning together and you're trying to support one another. So we're not going to judge people. We won't make assumptions about where they are. We're not trying to get in a combat or a conversation to change their views, especially when they're political. It's really a matter of saying, you know, thank you for sharing that information. Here's some facts, the part that is a fact that I can share with you, and let's continue on, right? You don't get into a combat of, you know, let me prove to you what you're saying is right or wrong. We know there's a lot of political or theories that can come out when we're having this conversation. You're not going to stand for 3 hours to try and decide whether there's a microchip in the vaccine. You really want to say, you know, thank you for sharing, thank you for sharing what you've heard. Can I provide some other information? And don't try and get in a back and forth about it. And in that also, you want to really just limit the information that you're sharing to what you're qualified to give. I don't know if some people are physicians, but if you're not, this is not the role that you're taking in this space. In this space is to connect to information that has been verified and that is consistent and that people feel supportive. And so I think the last thing that you don't do, that I think most of us are aware of, is not to share any confidential or sensitive information. You'll really be a part of people's lives at a moment when they can be very vulnerable, or they're sharing personal things with you. And even if you think it's basic, oh, this person told me, this is how they thought, or this is how I was able to move them forward, really be respectful that, especially in the communities that we're working with, there might be very closed communities, and we don't want conversations happening about what you've happened or what you've shared. So just be aware that even something that you might not think is personal or sensitive, it may be to someone else. And so just really avoid having those conversations outside of your trusted circle of coworkers or a place where you're gathering information.
All this that we're talking about all goes down to seeing the person as a whole, and honoring their experience. So, looking at people rather than just their vaccine decision, because, as the, COVID wears on and we really want to go back to normal, and vaccination, we're trying to hit a target of 90% vaccination. A lot of people are now saying, well, the unvaccinated are holding us back. And there's a lot of anger and a lot of polarization, meaning the people who are against it are very extreme in their views. And then the people who are for it are also very extreme in their views. And they come to see one another as just their, decision on the vaccine. And just to remind people that we are more than our thoughts and opinions about what this vaccine does and if we want to take it. We are people first and foremost. And so our decision on that is just one very, very, very small part of ourselves. So, we hear sometimes people say, I don't want to see that person because they're unvaccinated. That person's a sheep. I don't want to talk to them because they're vaccinated. I don't want this. Just thinking back to our humanity and just remembering that before this pandemic, before this vaccine was an issue, we were friends before that. And so not letting the vaccine, drive a wedge between people. Yeah, so we included this picture that because, once you start to promote the vaccine and you want to encourage people to take it, then you start to become, you start having this view where you just look at arms to just, put a needle in. That's all you see. So we just want you to zoom out and look at the person, and just think of that person rather than thinking about, their vaccine decision. And just remembering that, like, when you want to, talk to people about the vaccine, you're not there to convince them so that they can take it. You are there to inform them. And that takes the pressure off and makes you less likely to just see them as an arm that needs to be jabbed. Lydia-Joi wanted to just give a quick overview of what COVID-19 is, and just to help everyone here and get on the same page.
Yeah, and we also wanted to share that video is one of the examples. We hold a weekly session for all our community ambassadors. So this isn't the only opportunity that you'll have to be supported. And so what we basically do is bring in different experts as information comes out to answer your questions, to tell you kind of the detailed science behind things, so that as you're going out, you have that information. And so this is kind of some of the things I think at this point that we're so far in, we hope most people know the basics of it. But really just talking, what was COVID? Why is this so different than like a regular flu season? And so we've really talked about the idea that like this is a virus. So meaning this is why we're not taking antibiotics. This is a virus that looks different than something that we've seen before, because we know it's spread in the air, it's spread through droplets. And who is being impacted by this, or who's affected. I think from our work, this is really important because it's really everybody, but we are seeing some people who are having worse rates, worse effects after it because of other conditions, whether that is where they're living, whether that's access to other healthcare, whether it's other medical conditions they have. And we know people who have had other problems in accessing healthcare before, we're seeing this is actually affecting them more. And so what we're really talking about today are, what are our defenses against it? The vaccine is definitely one of it. What we've been talking about in terms of social distancing, keeping on masks, not being intimate and close spaces with people who are outside of our immediate bubbles or our circles, making sure that if we have any at all symptoms of any type of cold, that we are testing and retesting, and making sure to stay away from others when we have these symptoms. And then if we do become positive, that we're quarantining. So these are all the things that we have that are defenses against COVID. And these are all part of our jobs as ambassadors to share with people the right way to do this, how to access it, and support them through all of this information.
Now we're going to go into the third section of this presentation, which is about the root causes of vaccine hesitancy. And what that means is like what are the reasons that people are against the vaccine? So some of these are, and this is based on a lot of the research and a lot of articles that we've read just to compile everything here for you. Some of the reasons are like a fear of side effects. People are worried about what the impact of the vaccine would be. Some people doubt that the vaccine will be good enough to work against COVID. Some people worry about the vaccine trials and the way that they developed it. So they think it was processed too fast. Maybe they've had previous negative experiences with healthcare or with the vaccine, with other vaccines. Maybe they don't trust doctors that much, or the government. Maybe they have systemic barriers, which means that they struggle to actually even go to a testing site because they have long work hours, or are worried that their side effects will cause them to be too sick to go to work, and they can't afford to take a day off because they don't have paid sick days. they might fear the long-term effects. So they don't, like, you know, they say like, well, we don't know what the long-term effects are after 10, 15 years. Some believe that maybe the vaccine will make them infertile, so unable to have kids. Maybe they have difficulty accessing information, so to be able to read about the vaccine, or they are, you know, think that they don't have that they will not get COVID just because they don't go out or do anything to increase the risk of getting it. Or they think that even if they were to get COVID, that it's not going to be that bad. It's just going to be like a cold. Or they think that by eating healthy and exercising, that's enough protection against COVID. Or they believe like a lot of like, you know, conspiracy theories, kind of like, you know, Bill Gates created COVID or things like that. So it could be many, many, many reasons for being against the COVID vaccine. So we were interested in what you've heard in your community, because every community is going to be different. And that's what, you know, you should keep in mind, is that, you know, you might not hear all of these things and you might not hear any of these things. Each community will be special in its understanding of the world and what kind of reasons that they have against the vaccine. We wanted to open it up to you and see what what you've heard. What are the reasons you've heard that people are against the vaccine?
I wonder if Iman could join us and she can share what she hears and how her community, she belongs to the Arabic community and she hears a lot of feedback.
I've been myself, I wasn't sure, then I was like, maybe it's dangerous, maybe it's risk. But as long as I've been noticed people getting vaccines and being protective and taking care of themselves and others. So as long as I'm heard a lot in the news and how does the vaccine keep you safe and protecting. So I did myself, I'm from hesitant to run. I ran to my first appointment as I'm with the group, they call it resident leaders group to promote, actually, to promote the vaccines since we been getting the vaccine available, and now we're promoting kids vaccine. So I would like to say, from my experience, it's safe and it's protecting everybody, and I've been encouraging, and all my family, all my 5 kids, I have 7 grandkids, 2 of them are 5 years old. They got their vaccine. I feel, to be honest, I feel happy, energetic, move forward, encouraging others. We've been in outreach. So one of these stuff that people is maybe afraid or scared of, they hear, you know, but the culture, you know, I'm saying, to be honest, I'm being honest with you, like they were saying, I'm not sure what the culture in English, but you know, Miss Heidi ساعديني إنه بيفكروا بالنسبة they won't be having like kids in the future.
إيمان نور بتتكلم عربي، لو تحبي تتكلمي عربي برضو ما فيش مشكلة.
Yeah, okay, no worries. Yeah, I can hear them and welcome and appreciate it. Yes.
كنت بتقولي إن الناس خايفة.
عربي؟
أيوة اتفضلي. أيوة بتقولي الناس كانت خايفة إن يحصل عقم أو.
نعم بصراحة. and العفو، يعني بتعرفي انه مثلا خاصه ممكن المجتمعات الشرقيه تبعتنا باك هوم، وبعدين هون كمان في ناس كثير لسه بقابل ناس ما اخذت الفاكسين، بقول لها ليش، يعني شو السبب، شو المعنى، بتقول بخاف، ليش ادخل، بقول لك الصراحه، انا يعني بقول لك الصراحه، لانه انا مثلا بشوف ناس مثلا او كايند اوف الاوتريتش او مثلا من يعني مده من السمع مثلا في المسجد او شيء في عدد قليل، بتقول لي يعني ليش ادخل كيميكال الجسم، واحدة تانية بتقول لي أنا مش مقتنعة، واحدة تانية بتقول لي بطلوني من الشغل عشان أنا ما أخذت الفاكسين وأنا ما بدي أخذ الفاكسين، بسبب لي كذا، أو سمعت مثلا. كل المشكلة بسبب الواتساب وبسبب الفيسبوك وواتساب، إنه في ناس العفو يعني بتجيب صورة مشوهة أو صورة مزعجة عن مثلا بالنسبة للفاكسين، وربنا سبحانه وتعالى هو اللي بيحمي وهو اللي مش عارف إيه، استغفر الله العظيم يا ربي، إنه يعني ربنا هو اللي بيحمينا وبيدينا الصحة والعافية، ربنا بإيده كل شيء، اللهم صل على محمد يعني، ونعم بالله. بس احنا لازم وابتغوا اليه الوسيله، يعني احنا لازم نكون نحصن انفسنا، وان مثلا يعني نحمي انفسنا وعائلتنا ومجتمعنا. فبقول لك صراحه ليش في ناس كثير لسه بقابل ناس انه خايفه تاخذ التطعيم، ومثلا شابات، وهذا بالنسبه الصراحه اكثرنا من مجتمعنا العربي.
بالنسبه للاطفال بتسمعي ايه اكثر بالنسبه للقاحات للاطفال؟
ما ست هيدي عم بقول لك نفس الاخت هيدي اللي عم بتقول لي ليش ادخل كيميكال جسمي وانا مش مضطره ومش عايزه. هي عندها اطفال 3 4 5 and 7. عندها يمكن اعتقد 5 بنات 2 5 and 7 والولد الصغير 4. غير هيك انا يعني اولادي طعموا اطفالهم، يعني عم بقول لك صورتين متناقضتين يعني. وغير كده رحنا اوتريتش الاسبوع الماضي في اوفر بروك اريا. The people are happy, to be honest, they were happy to get the vaccine, and it's like because it's يعني المواد موجود، بنديهم الكارت. The card provided by OBH. We are the reason, or we are the connection between the OBH and the residents. So the people were so happy to get their kids vaccine because it's available at school. So they were happy to get their kids vaccine more than being happy to get vaccine themselves. And I'm seeing, I'm hearing like maybe you can do different scenarios.
شكرا كثير إيمان. For everyone else who didn't understand what she said that in her community there's a lot of misconceptions around the vaccine causing infertility. Also this being against the vaccine because of the idea of putting chemicals in your body and not needing to take it. And then with regards to kids, just the parents who are vaccine hesitant themselves are not allowing their kids to take it, and then the parents who are very vaccine confident are more than happy to get their kids vaccinated. I know I summarized it very shortly, Iman, so I may not have given it justice to everything you said, but thank you so much for everything you said. And I actually and then so another thing that Iman said was that a lot of people who are vaccine hesitant, they're getting a lot of their misinformation from WhatsApp. So actually I wanted to spend some time on that as well later in this session. So I want to show you this. This is something that was developed by a health marketing company that we worked with called Emergence Creative and 19to0. They looked through social media and did a lot of focus groups where they listened to what people have to say about the vaccine. And they found that in the section towards the left are some of the reasons people have against the vaccine. And then in the section to the right is the reasons why people are motivated to get the vaccine. So for example, people are more motivated to get the vaccine, to go back to normal so that the economy can open up again. So things like, less restrictions, and we can go to stores at unrestricted capacity. Sometimes people want to protect their community or protect their family, to protect themselves, to end the pandemic once and for all. And then on the other side, we have things like, people are against the vaccine because they're worried about the long-term effects, as we said, because they feel the vaccines, the mRNA vaccines, are too new, or they are scared of needles, or other political beliefs. So they are clustered. And so what we mean to show you is that there's a spectrum of beliefs and how much someone is against or accepting of the vaccine. So when you see somebody who's saying, I don't think I want to get vaccinated, you don't know if they're right here, you know, like they are so totally against it, or if they're on the fence and they're thinking, maybe, right? So, you know, just thinking about not putting everyone, you know, as black and white, you're either against or for, there's actually a long spectrum. And even the people who did get vaccinated, some of them did not get vaccinated because they wanted to, they got vaccinated because of the mandate. We have an anonymous saying, there's a lot of messaging around the Omicron variant being less deadly but highly contagious, which is making people hesitant to take the third dose as they believe 2 doses are enough. How can we approach these people and start the conversation? A lot of people are tired of talking about vaccines and it's becoming difficult to keep them engaged. Okay, so it sounds like this group is actually very engaged with their community, and you've seen a lot of what people are saying in the community. Lydia-Joi, do you want to speak to this slide?
Yeah, and I think we can also address this question around Omicron. I think, you know, all of us, this is the conversation that we're having right now. And I wanted to address that first. So we're still trying to figure out whether it is more deadly, as it said here, or it is less. What is clear is that it spreads quicker. We don't know yet what the rates of, like, whether you end up in the hospital, whether you'll die from it. This is what we're trying to figure out. So there's some really good information that's coming out of where they discovered it, like in South Africa. We're trying to still learn about it, but I think why the concern that's happening is because of how quickly it's spreading. So regardless of how sick you get, it's, you know, by the time we figure out whether it's deadly or not, it's been spreading really quickly. And so I think, you know, the conversation that we're having with people of, you know, why would you take a third dose, given that all of these things are unknown, is because, you know, the doses that we have, the majority still is not Omicron. We still have the other variants that are there, and we know that the vaccine and the doses are effective against those. So we still need to get to protection for what's in existence. The initial information that's coming out is that there may be a certain level of protection still for the new variant. We're waiting to find out. But we don't want to wait till we, you know, if it is completely effective and then it's already spread, we need to, in the meantime, get in front of it. We don't want to wait till what happened at the beginning when we were like, oh, you know, what is this? Let's wait. By the time you wait for those answers, it's too late. So the reason why they're still saying, let's go ahead, we know that having only, you know, there are 2 doses within 6 to 8 months, you don't have the same level of protection as you did right at the beginning. So we want to get everybody to having the most protection while we're figuring all these other questions out. So that's the reason why they're not just saying, hey, let's stop, let's not have boosters. Because if we do realize that we need it, it will be too late to then vaccinate everybody much later when the spread has gone so far. And I just wanted to add that, you know, we're tired of hearing about the vaccines. Nour and I laugh all the time that sometimes we can't even get to say C in COVID, and people are like, let's stop talking about this. So we absolutely understand that. And I think this is why for us that the conversation doesn't have to start with COVID. It doesn't have to start with vaccines. And this is why we were saying, you know, we really have to look at people as a whole, and they might have other things that they want to speak about at this time. You know, there's other health conditions, there's other supports that they need. Maybe they just want to talk about everything but that, and that's okay. That's still part of our job. That might be what it is, like connecting people on other levels. And then when they're ready, or if they have a question, they feel comfortable enough talking about it. Because definitely, I think that, you know, people, we have had enough. We want to feel back to some sense of what we are used to and comfortable with, and not having these difficult conversations all the time. So it's understood. So I think, you know, how we've approached it is that, you know, again, I think the main thing that we've done in the vaccine messaging is actually to not only talk about the vaccine. I think, you know, it's okay to go back to talking about everything else, and really separating it from, you know, how is it that people feel about this politically? You know, I heard some of the things that Iman said about, like, you know, why is this happening? Like, some of the questions people have, it's okay to say, yeah, we all have those questions, even us as workers. Like, let's admit that we all have things there's risks on both sides, and it's okay to have that conversation, but separate that from, but what are we going to do to keep ourselves safe right now? We can have those questions and still stay safe in the meantime, right? So it doesn't have to be an either or. We can say, well, let's discuss, what are these chemicals we're putting in our body? Let's look and see what is in this vaccine. Is it very different from other things that we've experienced before? Do we feel comfortable? What's the level of risk? Keep those conversations coming, to say it's reasonable, and actually it's very healthy to have questions. You shouldn't be doing things or participating in something that you don't understand, and that's okay. But let's make sure that the information we're getting to answer it is really based on facts. And I think the other part of the conversation for people who are tired of talking about vaccines is that this isn't the only thing we're saying. The vaccination isn't the silver bullet, as we'd say. It's not the one thing. It's everything else. So how are we still, washing our hands, not touching each other, not doing certain things that are increasing it? All of these things are important. But it's important, unfortunately, we have to talk about it now. We don't have the time to say, let's have this conversation for another year. Things have been changing very quickly. I know for Nour and I, we have just been shocked that even the last week, our conversations in community and work have changed completely. We were just ready to take a vacation, and now it just completely changed. And so, unfortunately, we have to have the conversations now, but we can talk about how we feel while we're having those conversations.
This last part that she mentioned, that we were all really ready to get into the vacation. We now know that Omicron is spreading very quickly. So what can we do and say? Because family members will be starting to meet, all these gatherings, and now we know that there is really that the third dose helps to stop the spread and to reduce the numbers.
For sure. So in Arabic, and I hope most of the participants can understand, احنا كثير من الناس يعني كثير زهقوا من هذا الموضوع، من الفاكسينز كلهم. يعني معظم الناس يعني حتى to even convince them، بس انه تحكي لهم انه مشان الله خذوا الفاكسين، يعني اخذوا التنين وخلص قالوا انتهى الموضوع، انا مش هاخذ اكثر من هيك. فحتى تفتح الموضوع ثاني تقولي لهم هلا بدنا third dose، بصيروا يحكوا اوكي لا انا ما بدي اكثر من هيك، انا I signed up بس عشان اخذ التنين مش اكثر.
ان احنا اتفقنا هناخد جرعتين بس، دلوقتي بتقولي كمان في جرعة ثالثة، فكده كتير بقى، فامتى هينتهي الموضوع؟ لكن يعني كأن التطعيم او اللقاح هو المشكلة، مش الفيروس هو المشكلة. يعني أنا خايف، ما زلت بدور في نفس الدائرة، إن أنا خايف من التطعيم أكتر ما أنا خايف من الفيروس نفسه. وأعتقد هي دي المفارقة اللي إحنا يعني محتاجين نوضحها، إن اللقاح أيا كانت ممكن تكون السايد إفكتس بتاعته إيه، أو أي مشاكل يعني قد احتمالية تكون فيه، هي بأقل بكثير من اللي ممكن يعمله فينا الفيروس نفسه. مش بس عشان بيقعد اسبوعين بتبقى مريض جدا، لكن لللونج افكتس. في دلوقتي دراسات يعني بتشير ان في ناس بتفضل متاثره لشهور، مش اسبوعين بس.
فأكتر شيء لازم نحكي للناس إنه إحنا كمان برضو حاسين في نفس الإشي، إحنا برضو كمان زهقانين، إحنا برضو حاسين اللي هم بحسوا فيه، وهذا يعني is out of our control. إحنا we are reacting يعني to the vaccine to COVID itself. وهو COVID اتغير because كل الفيروسات أصلاً تتغير، بضلهم يعني they genetically mutate، بتغيروا حتى في الجينات،
بيعمل طفرات. الفيروس نفسه بيحصل له طفرات ويتحور وياخد شكل تاني، لان ما قدرناش نتحكم فيه ونسيطر عليه في مده سريعه، فبنديله فرصه ان هو ينتقل لناس اكتر ويبدا يتغير ويبدا يقوي نفسه عشان يقدر يعدي ناس اخرين. لكن لو بنقدر ان احنا بسرعه ناخد التطعيمات ونقدر نتحكم فيه بسرعه، عمليه التطور دي ما بتحصلش، ما بيلحقش يطور نفسه بالشكل ده.
وهلا حاليا لاستعداد الهوليديز الفاكسين الثيرد دوز حاليا بيساعد lowers the percentage ب 75% the chance of getting really sick من the new variant of COVID. وهذا النيو variant كتير معدي أكثر من دلتا حتى. ف staying safe is really important عشان هذا الفاريانت يعني حيفوت في البوبوليشن كله بشكل كتير سريع. وإذا يعني if it was not contained حتى لو it's milder, even if, and I don't know if the person who asked this question originally about Omicron, even though it is said to be milder, we don't know how mild it is.
إن هو سريع الانتشار لكن ما هواش بيخلي الناس تمرض قوي، لكن بتختلف من شخص لآخر، ما نعرفش هو هيبقى قد إيه. برضو بحب أكد على الحتة اللي أنت قلتيها إن 75% الجرعة الثالثة بتخلي 75% حماية أزيد بعد ما بتبقى بدأت المناعة بتاعتك تقل بعد 6 شهور من أخذ الجرعة الثانية. فكل دلوقتي الأرقام بتؤكد أن الجرعة الثالثة بتساعد في الحماية من أوميكرون. وشركة فايزر نفسها أعلنت ده، إن عملوا تجارب إن لقى إن بتقلل كتير جدا وبتديك حماية تانية لما بتاخد الجرعة الثالثة.
وبالاخر احنا كلنا زهقانين من الموضوع، مش ما في واحد فينا والله مبسوط على الموضوع هذا. فيعني even though يعني انا مستعده اخذ الثيرد دوز، مش معناته انه مبسوطه او انه قاتل حالي عشان اخذ الفاكسين بصراحه، بس انه خلص انا عارفه انه هذا المطلوب مني، وانه this is something that I have to do عشان احمي نفسي واحمي ابني واحمي جوزي واحمي الجميع يعني اللي حوالي. فيعني انه to just be empathetic، انه في كتير ناس لسه ما وصلوا هاي المرحلة يفكروا بهاي الطريقة. فأنت يعني شغلنا إنه نخلي الناس يعني تهدى شوية، because كل الناس معصبة. أوكي، تهدى شوي، تروق شوي، وبعدين نحكي لهم عن هذا الموضوع شوي برواقة. نحكي لهم إنه إحنا كمان حاسين نفس الحاجات اللي هم حاسين فيها، وخلص إنه هي هيك الدنيا. we didn't foresee this, we didn't want this to happen، بس خلص هذا الموجود. فيعني just understanding where people are at, and a lot of people are more frustrated and more angry than ever before, and to just empathize with that, and to and so for all the English speakers to just also say that we are also in the exact same place, and we feel the same feelings. The rest of this presentation is really amazing. We promise you some of these sources are really helpful. This one, for example, gives you a lot of things that people say, and then the most helpful response to say back. But all of these also are great. For example, this one is a vaccine injury support program for people who have had bad side effects from the vaccine. They can actually apply for compensation, and this is from the government itself. And then in terms of credible sources, I just want to say what Iman actually did say, that a lot of people who are vaccine hesitant, who are against the vaccine, are actually getting their information from different sources than the people who are vaccine willing, who are interested in getting the vaccine. Lydia-Joi, do you want to speak about this?
Yeah, just really briefly. And it sounds like our group kind of already knows these, but when we're advising those we're speaking with, a lot of people will say they did their research. And so we just wanted to offer to you when they're saying this, these are some of the questions that you really have them ask. As we said, I know for my family, we definitely do the WhatsApp news, but even with that, these are questions you can ask. What is the source? Where did it come from initially? Is the person who is putting it forward, are they sponsored? We're seeing a lot of even, WhatsApp information that will be for someone selling a vitamin or something else. And that's why they're like, this is what you should do instead of a vaccine. Are there any conflicts of why and who's benefiting for the message that's coming? Is it coming from public health, or is it a private individual? So some of the resources that Nour sent you, that's why we included many of the government resources. And we know that just it being from government doesn't mean that someone will trust it, and it doesn't mean that there can't be information that is evolving, but at least it's a start that it is accountable because it's public. You can ask questions, you can go through it, you can say, you know, is this right or it's not? And the information can be there. So ask those questions. Look and see who has published it. So who's the author? Is it somebody, you know, with a science degree, a social degree? Where did they get this information from? What is making them the expert? And one of the big things that I always look at is like, is it a balanced view? Anything that says absolute in either direction is probably something you should question. If it says it absolutely works or absolutely doesn't work, like this is not how science works. You know, as we were discussing, genes are changing, information is changing, like the virus is changing. For you to stand in one time and say this is absolute and not say, well, these are other possibilities, is something you should really question. And whatever results that they're giving you, if they're saying, you know, instead of taking the vaccine, you should drink this magic treatment. Well, even if it did work in one person, was that able to be reproduced somewhere otherwise, right? How do you actually say that this is a cause and effect? These are questions to ask people. People are often very set in their ways and what they believe to be truth. And again, we're not being there to argue with people, but to offer them another way to look at it. So it's like, oh, you know, even yourself can ask the question, did that result that you were seeing that you think is otherwise, was it seen in more than one person? Who is it who wrote it? Just ask these questions and maybe show some of the other sources, like some of the ones that Nour will share with you, as other examples that these questions have been asked and they met the criteria for information that is factual and not just, you know, there might be other sources in it that might be tainting what the information is.
Yeah. So these are some examples of resources. As I was filling out the slide, I was, you know, picking out some of the most prominent, vaccine, incredible, you know, sources of information. And then as I was filling things out, I stumbled on World Health Organization and I added it, but then I felt a little bit of a resistance, and only because of, you know, the beginning of the pandemic, how they had initially said, you know, COVID is fine, it's no big deal. And then all of a sudden after that, they said it's a pandemic. And then so it kind of brought back memories to me of how I, you know, was upset with them about how they mismanaged the, you know, and began this entire pandemic so slowly. So it made me think about how, you know, even when we share resources that we find credible, other people, based on their experience and how they view that organization, might not agree with you, even though that organization is credible. So so you have to keep in mind kind of where people are at and how they view certain organizations based off their experiences and their opinions of them. And so when you share resources from a credible or what you deem credible organization, also keep in mind like what sources they trust, because you don't want to lose that entire conversation by drawing on a organization or authority that they don't themselves trust. So trying to have that conversation, you know, like what we have a question here of like, you know, my mother is extremely involved in Facebook science. How do I explain to her what isn't credible, and how do I teach her to understand these sources, even though they're not exactly digitally literate? That comes down to asking them, like, who do you trust? What's an organization that you trust? Do you trust a specific individual? Do you trust like this organization? And then go through the previous slide and do that exercise with them. So if it's an individual, okay, so what are their credentials? What lets them speak about this topic with authority? Or if it's an organization, let's say, so this applies to both. Do they have a conflict of interest? Are they paid or sponsored to say what they say? Are they profiting from it in some way? And that's just a question. I mean, whether it's a yes or no, you know, that doesn't devalidate, but it helps us think of like why they're motivated to say something. What's the number of people saying the same exact thing, right? There are 80% of people telling you, yes, this is safe. And then like 10 people who have like lost their license and are deemed to be completely, you know, not credible in that field of study? Are they the ones who are saying, no, it's not safe? Like we have to think about the larger context, not just one person or one organization, but what are the majority also saying? And then so when you're talking to specific individuals, get a feel of who they trust and who they don't. And then with those they trust, kind of work with them. Okay, well, if you trust these number of people, how do we kind of filter and apply a certain standard to help you figure out who's more trustworthy among those sources, who is more trustworthy, and then go through them and look at what do they say. And then when they say those kind of things, like, you know, looking at the specific things that are said, assess, you know, is this correct, and allow them, you know, teach them those kind of fact-finding exercises. So that really helps people, you know, find the correct information for themselves. So these are just some more resources for yourself. I won't go through any of them in detail. This is again like more resources if you want to, you know, go into detail about how vaccines work and how they were developed, if you are curious. The rest of this section is also like about the typical things that people say against the vaccine and how, you know, some of it is based on incorrect information or incomplete information. So you can, you know, it's helpful to find ways to respond to them. And then some of the current hot topics, I think that some of you have mentioned. So Iman, you mentioned vaccines for 5 to 11. So these are some pamphlets and resources on that. So we even have a kids resource. We have a resource for parents who are worried about myocarditis, which is the inflammation of the heart, and you know, if it's rare or not. And so lots and lots of information there for vaccines for 5 to 11. Some of the key messages to tell people about getting their children vaccinated, and, you know, based off the things that most of the questions that we hear. And then Iman also mentioned vaccines and fertility. These are a lot of resources on vaccines and fertility. Also for women who are pregnant and breastfeeding or trying to conceive, there's information about taking the vaccine while pregnant or breastfeeding. You know, the information about Omicron is evolving. We don't have the complete picture yet, but this is some of the information we do have access to that you can click through and read on. And then boosters and third doses, as we have said, this is quite a recent topic. So this is a live document. So anytime you click it, whenever we update it, there's going to be more information and you can actually see it. Right now, we have some information from Women's College Hospital. It'll answer a lot of the technical questions, like if I got a mixed dose, mixed vaccines, what do I take for my third? Is it going to be mandatory? Will it show up on my vaccine passport? There's a lot of questions that people have, even if they are now, you know, deciding that, okay, yes, I do want to take it, which is a step in itself. There's a lot of like secondary questions that come after that, on how to book and what vaccine to get and whatnot. So we have some information there for you. So we just, I guess, wanted to open things up for questions, and have you guys just share back what you've learned, if you'd like, before we end this session.
Nour, I'm just seeing one of the questions posted. You addressed one of them, but the other one in terms of, you know, how do we have conversations with people who are hardcore anti-vaxxers? And I think you addressed most of it, but I would say, yes, from our work, what's here, there's maybe 5% of people who they've made a decision. They're very stuck in their decision. And as this goes back to, we're not here arguing with people, that conversation just looks like, how are you staying safe in the meantime? I think it's really one of the tools to determine, is this a conversation worth having? Or can we at least have the conversation of, how are you going to be safe? Majority of people do not fall under that category. I think the news and what we see like that makes us think that like there's really hard anti-vaxxers who are, you know, protesting in on the streets. Majority of people just have questions. Majority of people are fearful. The majority of people want more information to make a decision, and it's a hard decision. Most people do not have strong political beliefs. and people who you do encounter there, yep, the conversation for that is, well, what else are you going to do? Do you want a mask? Do you want a sanitizer? Please don't come out if you're sick. So it's really knowing when that conversation is going to be useful, and it's not useful to get into like a battle over people who are really set in their ways.
What is the rate of vaccine-induced myocarditis in kids under 12 years old, reported in the city of Ottawa? This is released on December 6th, 2021. Yes.
For the children 12 to 17, it was very, very low. For the 5 to 11, it's almost nothing. Like there were no reported cases.
The other thing to stress is that the impact of COVID is much more likely to cause myocarditis or multi-system inflammatory syndrome, which is what Lydia-Joi taught me yesterday. And it's much more likely to cause it because of COVID rather than the vaccine. So for parents who are really worried about myocarditis, helping them through assessing the risk of getting this condition from the vaccine and comparing it to actually for their child to get COVID, just comparing those two odds is actually very helpful.
لو تحب سعود ان انت تاخد المايك وتكلمنا عن ايه اللي بتسمعه من الجمهور، من الناس، ايه المخاوف. ممكن ان انا اعرف ان حضرتك من الامباسادورز للفاكسين امباسادورز في المجتمع، فلو تحب ان انت تشاركنا في دوت برضه.
Yeah, شكرا. So it is a very frequent question I receive about the rate of this case has actually happened here locally in the city of Ottawa. So that's actually the main reason why I asked about the rate. I know the rate worldwide. I know how severe it is. Well, I don't know exactly how severe the case is reported in terms of city of Ottawa. Again, just like you, I get access to PHAC statistics, but I'm more curious about the city of Ottawa statistics by itself, because most of the questions I actually get asked is concerning locally here, pretty much. So what I would like to say is pretty much this side effect is still very rare. It should not really discourage us from giving the vaccine to our kids. In fact, doing the basic fundamental principles of science, talking about benefits versus the risk assessment, pretty much. So benefits versus the risk associated with giving the vaccine to kids. I think so far the vaccine approved itself. One of the issues that I come across is pretty much it's about the heart inflammation in the kids. Now, before it was something to do with the thrombosis induced by viral vector vaccines, aka AstraZeneca. But I think now we pretty much start administering AstraZeneca here in Canada. So I would just like to highlight your effort here. Thank you so much. And I think we need more of this. There are a lot of people still in hesitancy to take the vaccine. Especially now we're really at the edge of giving or taking the third dose, and there is a huge resistance hesitancy associated with that. One of the problems lately surfaced again with the Omicron variant complicated things a lot, to be honest. But I think a lot of people I know or discuss the things with me, they are fully vaccinated people. They actually took 2 doses of Pfizer and Moderna vaccines, but they are unwilling to take the third dose because, again, they think, and which is a valid thing, and I think they think it's actually this is some sort of, excuse my language, it's a money grab rather than considering health benefits here. So I think it should be more education like this. I really appreciate the work you guys are doing.
Thank you so much, Saud. That's really amazing. And we also like to always stress that you and the participants here are the real experts in this space. though we are teaching this information, you are the eyes and ears on the ground, listening to what your community is saying, listening intently to what their questions are, what the gaps are. So it's also always helpful for us to hear back what you say, because like you said, in different communities, there are different questions and different gaps. So myocarditis, as you are saying right now, is one issue in your community. So it's different for every community. And that's really helpful for us to hear as well. Thank you all so much for joining us today. This was a really wonderful conversation. I enjoyed listening to you and what you've heard from your communities.
Thank you so much. Thank you, Nour and Lydia, for joining us today. It was really a pleasure. And we like to thank everyone who attended. شكرا لكم جميعا على تجاوبكم وعلى حضوركم وعلى وقتكم. وعلى أنكم سفراء للقاح. شكرا لكم.